So welcome to Girls Night In for Men. And I'm Dr. Bruce Katz. I'm a clinical professor at the Icahn School of Medicine at Mount Sinai, director of the JUVA Skin and Laser Center, and past director of the Cosmetic Surgery and Laser Clinic at Mount Sinai Hospital. So I'm going to talk about different cosmetic options for men that they often wish to have. And first of all, we'll start with some of the topics we're going to discuss. First of all, we'll talk about skincare, and then how to do hair removal, hair restoration for people who are thinning out, how to resurface the skin in cases of acne, scarring, or wrinkling, or loose skin, and then the latest options for body contouring. So just talking about topical skincare options, a lot of men just to have anti-aging benefits from using different types of what we call cosmeceuticals. You can have retin A, alpha hydroxy acids and beta hydroxy acids, as well as peptides and antioxidants. So these are different creams that you can apply on a regular basis to slow down the aging process of your skin. We offer men's facials as well in our Medi-Spa, and then one can have microdermabrasion if you have rough, dry skin, and then chemical peels, which often help with acne or blocked pores, blackheads, whiteheads. And we can use alpha hydroxy acid peels or the pulse peel to treat sun damage. And then often men wish to have fillers if they're developing deep laugh lines or marionette lines on their faces, or losing volume. We have nice fillers that'll help restore volume in different areas of the cheeks, for example. And then Botox injections for that, what we call dynamic wrinkles, worry lines between the eyebrows, forehead wrinkles, as well as crow's feet wrinkles at the edges of the eyelids. Let's talk a little bit about laser hair removal. A lot of men are getting into this more recently. And the most common areas that are treated are in men, the neck, the shoulders, the back and chest, but some guys also need it when they're growing hair on their ears or their face, on their abdomen, arms, and legs. There are a variety of different techniques available for hair removal, such as waxing, depilatory creams, and electrolysis. But those are really old-fashioned techniques, and most people today prefer to do lasers, or what we call laser hair removal. And at JUVA, we find the most effective treatments are the Vectis laser and the Apogee laser. And these are both FDA approved for permanent hair reduction. And the Apogee particularly is safe for all skin types. First myth that a lot of people believe in: you can't do anything about razor bumps or ingrown hairs or shaving irritation. Well, there is something we can do about it. In a recent American Academy of Dermatology poll, 78% of men who shave said they have some type of irritation that they experience. Very commonly razor bumps and ingrown hairs. And this happens when the hair is cut too short and curls back into the skin and then develops into these ingrown hairs. And the bumps are often painful and cause scarring, actually, in some cases. What are some good shaving tips to prevent these from happening? Certainly wet your beard before you shave. Shave in the direction that the hair lies rather than shaving against the grain. Avoid repeating strokes of the razor, and try to keep the skin relaxed while you're shaving. And consider laser hair removal if you have severe problems such as ingrown hairs or razor bumps that keep causing irritation. Another myth that excess body hair is really hard to remove. It's not true. We have temporary removal techniques that are time-consuming, as I mentioned earlier, not very good for large areas of the body like the back and the shoulders. And laser hair removal today works very quickly. We have these large hand pieces, so we can usually treat an entire back or chest in less than 20 minutes. Also, laser hair removal works for targeting pigment in the hair follicles and inches the hair follicles so the hair can't regrow. And lasers now, as I said, are effective on all skin types. This is an example of a beard area. Guy was having problems with razor bumps, as you can see here, these small little bumps all over. And then after 6 treatments, pretty much clear from the hair in the beard area. Another example of the back hair before and after, and also of chest hair before and after as well. Okay, let's switch gears and talk about how to restore hair. You know, particularly if you're thinning out. A lot of guys start getting bald even in their 20s and 30s. And women often have diffuse hair thinning that now we can actually treat. And most common treatments we start with are minoxidil or Rogaine, which you all probably have heard of. Propecia is a medication you take by mouth that we recommend really for men only because it's not safe for women, though in women after menopause it is safe to take. Viviscal supplements and elixir, that's another supplement you can take and an application you can apply. But the latest and most effective treatment for hair loss is platelet-rich plasma. And we basically draw one's blood, take out the platelets which have growth factors in them, and then inject them into the scalp to regrow hair. Another myth, your mother's father is to blame for your hair loss. Not true. Male pattern balding can come from either side of the family. And like I mentioned, treatments like minoxidil and finasteride are very effective. And they basically work by blocking the hormone that causes male pattern baldness. And Viviscal supplements are a marine extract that actually stimulates the hair follicles to grow. Here are some examples of thinning of the hair before and after treatment with Viviscal. Another example here, a thinning of the frontal area here, and then after supplements with Viviscal as well. Someone with real diffuse thinning here on the scalp, and after treatment, 3 months only of Viviscal. And here is an example of a guy with thinning of the front of the scalp, nice regrowth. And this was with PRP, platelet-rich plasma. And another example here of the crown of the scalp before and after treatments with PRP injections. And here as well, more examples of PRP and PRP as well. Let's talk a little bit about skin resurfacing for men. And what do we do this for? Basically, in cases of acne scarring, wrinkles, age spots, sun damage, and loose skin. And there are a variety of different techniques for this. We can use fractional CO2 lasers and erbium lasers. We use more in darker skin types, and also microneedling with radio frequency, which is actually safe in all skin types. Recovery really is very quick, and we can customize it based on the person's lifestyle. You can do more treatments with less downtime, or if you don't mind a little more downtime, you can do fewer treatments. And the same for the erbium YAG laser too. Here's an example. You can see the upper eyelids before and the nice tightening, lower eyelids as well, taking away the wrinkles. This is with fractional CO2 laser. Acne scarring here, before and after, with fractional CO2 laser. This is an example of microneedling and radiofrequency, not only to treat acne, but also to improve acne scarring. Let's talk now about body contouring for men. And the typical things that men wish to have these days is fat reduction, muscle toning, actually to rebuild muscle, and skin tightening as well. Starting off with SmartLipo for men, this is what we call minimally invasive. And here you can really remove all the fat in any location you want, including the love handles, the flanks, abdomen, breasts in cases of gynecomastia. We do it under local tumescent anesthesia. And usually we tell people just to take off the day after the procedure, and you can go back to work the next day. Here are some before and after photos of SmartLipo, the abdomen before, as you can see here, and after, nice reduction of the fat. Another example of love handles, before and after as well, give you a nice V-shape physique. And then what we call man boobs or gynecomastia before As you can see, the nice flattening of the breasts in men after SmartLipo. What we do for non-invasive fat removal is one of the newer treatments called SCULPSURE. And here we can treat the abdomen, the love handles, the thighs and back, or really wherever there is fat that you wish to have removed. It usually requires 2 25-minute treatments, 6 weeks apart. They're really easily tolerated, no pain or downtime. And also because it's a laser, we can tighten the skin as well as remove the fat. This is what the laser actually looks like. You can see here, there are actually 4 different applicators. So you can treat more than one area at a time during one 25-minute session. It's hands-free, so our technician just puts the applicators in place and you can walk out of the room. 25 minutes later, your treatment is finished. And we can treat all skin types with this laser as well. And here's some examples of the neck area before and after SCULPSURE. Another example here, before and after SCULPSURE as well. And you can see the flank area. Here's a good example. Look at the arrow before. A nice reduction in the flank area with SCULPSURE as well. And take a look at this abdomen. Look at the arrow before. Look at the nice flattening there, just with one 25-minute SCULPSURE treatment. Outer thighs before and after. Look at that arrow. And even another example of the thighs before and after with nice flattening and removal of the fat, but also nice tightening of the skin as well. You know, with what's going on with the coronavirus over the last few months, a lot of people have missed their gyms. They haven't been able to work out with weights, so we're losing a lot of that muscle mass. So M-Sculpt is a great opportunity to restore that muscle mass. You can treat the abdomens, the biceps, the triceps, and the calves. Usually we do 2 treatments a week for 2 weeks for a total of 4 treatments. Each treatment is only 30 minutes and there's no downtime or discomfort. Here's what the applicator looks like. This is when we first started getting this technology. We only had this large applicator to treat the abdomen. And also in women, we can use it to treat the butt. But a lot of people say, well, why can't we do this for our arms and legs, really build muscle in the biceps, the triceps, and the calf muscles? So voila, the company actually came out with one, and I'll show you in a moment. But here's an example of the abdomen. Not only have we, and this is a 3-dimensional image, not only do we see a reduction in the circumference of the weight, but also a reduction in the volume. As you can see here, before and after. So these are the small applicators that I told you that have just come out recently. We actually did the FDA trials for this as well. And basically you can apply to different areas here for the biceps, here for the triceps, and then for the calf muscles. Here's an example of nice toning of the bicep muscles before and after with M-Sculpt. You can see more definition over here with the muscle. More definition here, the calf muscles before and after as well. And more definition of the calf muscles here with M-Sculpt. What about skin laxity or loose skin? Well, these are the typical target areas that we're looking to treat. Loose skin under the neck or on the jowls or the abdomen. Also upper arms when you get loose skin here, and even around the eyebrows and the eyelids that become sagging or drooping over time. One non-invasive approach is microneedling, as you can see here. Just back up. These little needles that come out of the applicator and are energized with radio frequency. Here's a nice example of tightening of the loose neck skin here before and after with microneedling radio frequency, and a close-up of the neck before and after as well. Another approach is Excellis Ultra. This combines radio frequency and ultrasound for skin tightening. We use it mostly for skin tightening. And here are some before and after photos as well of the neck before and after with Excellis Ultra. And another example of the neck before and after, nice tightening with Excellis Ultra. Probably the most effective modality now for skin tightening is one that's minimally invasive, where we actually inject local anesthesia to the area so you don't feel it, and we go under the skin. And actually, this is a new technique called face tight and body tight, also AccuTight. And there are basically two electrodes, one here, this part here that goes under the skin, and this electrode that goes above the skin. And this is what we call bipolar radiofrequency. And you can see here in this animation how the electrode is under the skin here and on top of the skin and shoots energy between the two to stimulate collagen and tighten the skin. And here are some nice before and after photos of the neck before and after with face tight. And another example as well, the neck before and after with face tight. Some more examples of the neck and jowls. You see a nice tightening of the jowl here and the neck before and after with face tight. And body tight here to tighten the upper arms where we have loose skin there as well. So, final myth, like it or not, tattoos are forever. Not true. With our new Picosure lasers, we can break up the dye in tattoos. This new laser usually requires about half the number of treatments that previous lasers required, usually several sessions. And we can really treat all different types of tattoo colors, from light blues, aquas, and green, orange, and reds, all with very few sessions. And here are some examples of a tattoo with a Picosure laser before and after. And thank you very much for your attention.